Cystic fibrosis is a progressive genetic disease that causes persistent lung infections and limits the ability to breathe over time. Cystic fibrosis is due to a mutation in the CF gene on chromosome 7. Every person inherits 2 CFTR genes, one from each parent. Children need to inherit one copy of the gene from each parent in order to have the disease. If children inherit only one copy, they won't develop cystic fibrosis. However, they will be carriers and could pass the gene on to their own children. The mutation of the gene changes a protein that regulates the movement of salt in and out of cells. The result is thick, sticky mucus in the respiratory, digestive, and reproductive systems, as well as increased salt in sweat. Many different defects can occur in the gene. The type of gene mutation is associated with the severity of the condition. People with cystic fibrosis can have a variety of symptoms, including very salty tasting skin, persistent coughing, at times with phlegm, frequent lung infections, including pneumonia or bronchitis, wheezing or shortness of breath, poor growth or weight gain in spite of a good appetite, frequent greasy, bulky stools or difficulty with bowel movements, and male fertility. In people with cystic fibrosis, the body produces mucus that is abnormally thick and sticky. This abnormal mucus can clog the airways, lead to severe problems with breathing and bacterial infections in the lungs. These infections cause chronic coughing, wheezing, and inflammation. Over time, mucus buildup and infections result in permanent lung damage, including the formation of scar tissue and cysts in the lungs. The features of the disorder and the severity varies among affected individuals. Lung function often starts to decline in early childhood in people who have cystic fibrosis. Over time, permanent damage to the lungs can cause severe breathing problems. The thick, sticky mucus can also block tubes or ducts in the pancreas. As a result, the digestive enzymes from the pancreas can't reach the small intestine, causing impaired absorption of fat and protein. This can cause vitamin deficiency and malnutrition. Cystic fibrosis used to be considered a fatal disease of childhood. With improved treatments and better ways to manage the disease, many people with cystic fibrosis now live well into adulthood. Adults with cystic fibrosis experience health problems affecting the respiratory, digestive, and reproductive systems. For those who make it into adulthood with cystic fibrosis, there are some obstacles that will be faced. Infertility in men is a big one. Almost all men with cystic fibrosis are infertile because the tube that connects the testes and prostate gland is either blocked with mucus or it's missing entirely. There's a reduced fertility in women. Although women with cystic fibrosis may be less fertile than other women, it's possible for them to conceive and to have successful pregnancies. However, pregnancy can worsen the symptoms of CF. People with cystic fibrosis are at a higher risk of developing a dangerous thinning of bones called osteoporosis. They may also experience joint pain, arthritis, and muscle pain. And also, many people with CF have mental health problems. Dealing with a chronic illness that has no cure may cause fear, depression, and anxiety. Children with cystic fibrosis face barriers to occupational performance in everyday age-appropriate tasks for a variety of reasons, including time spent in medical care, increased self-care burden, decreased physical capacity, social isolation, and psychological factors such as anxiety and depression. Cystic fibrosis also causes your sweat to become very salty. As a result, the body loses large amounts of salt when sweating. So it's important for the occupational therapist to keep this in mind during any activity. Thanks for watching.